Hi everyone, welcome to my next session. Today we will be talking about everything mask related, the importance of wearing a mask. And I have with me Dr. Rakhee from Dr. Rakee's crib. We work together in the same clinic, the Baby and Beyond Child Specialist Clinic in Publika. Let me just see if I can add her into... Hang on once again. Let me just see if I can invite her. The discussion. If you have any, hi Dr. Ravin. If you have any questions, please feel free to ask them. We will be covering topics related to masking in children, as well as masking in adults, before and after vaccination, the importance of masking, what sort of mask we should be using for our children, and what ages should we be getting these masks on. So we'll be discussing all of these together. So please feel free to ask us any questions that you may have. And also, hang on, let me just see if I can... see if I can get her into the room. There's always that trick of... Okay, we'll just wait for her to come on live. So in the meantime, how has everybody been? It's been a very slow week for me. A lot of my patients are stuck in traffic, a lot of roadblocks, a lot of police roadblocks. So many of them cannot come for their appointments. But please let your doctors know if you need a letter. I think most of us remain open. We are essential services, whether we're in the private or in the government side. So please let us know if you need a letter to travel for any of your treatments or any of your appointments. Hi, everyone. We're just waiting for Dr. Rakhee to join us. Hang on, let me just send her an invite once again. Rakhee, if you're there, you just send me an invite. I've sent you an invite already. Are you able to click on it?
Ah, hi. Hi, Rakhee.
Hi, Rakhee. How are you?
I'm good.
Thank you for joining us today.
Thank you for having
in between your busy schedule of clinic and the kids and the sleeping time and all. So glad you could join us.
My pleasure.
I just basically wanted to allay all the questions that I've been getting from my followers with regards to masking in children, masking in adults, and maybe we'll go through one by one, and we'll look into what are the current guidelines that we actually have for wearing masks in children. Would you want to start?
Yeah. So thanks for having me. I hear you, and I hear the questions that your followers have. I think if you ask me, the guidelines that I look at with regards to mask wearing for adults as well as for children is the CDC or the AAP. So if you look at the Center for Disease Control, US guidelines, as well as the AAP, right? The American Academy of Pediatrics, it says that anyone 2 years of age and above should be wearing masks. They do advocate either a cloth mask or a 3-ply surgical mask. And when we should be wearing that, it's the same for adults and children, and that is if, you know, we are on the outside, we're in a public area where we are exposed to other people other than our own household. And, you know, if, let's say, it comes upon a time where there is somebody who's tested positive in the house, then we should wear the mask at home as well.
Okay, interesting that you brought that up. So I think one of the other things that you should take into consideration is if you have someone that may be immunocompromised also in the house, you may need to also wear the mask as well. And like you correctly said, 2 years and above is what we follow in the American Academy of Pediatrics. But I have been seeing some of my younger patients who do wear a mask to clinic, and they're most welcome to wear one as soon as they can understand the need for one, and they find a mask that fits snugly for them. Like if you put a huge mask on them and it's falling all over the place, it doesn't really make a purpose for wearing the mask. So it has to be a well-fitted mask. For parents who are not sure out there about the types of masks, besides cloth and surgical, there's also the adult size mask, which is slightly bigger, and you also have the pediatric or the children size mask. So you could actually get them separately. So the children wear their children size mask that fits their face quite snugly, covers their nose, covers up until their chin, and it goes here. So now there's this new trend about double masking. So what are your thoughts on double masking for children?
Yeah, so there are a lot of like stuff that you said which was really interesting, you know. So if I can just bring back a little bit, I'll come back to the double masking. Like, you know, for children younger than 2 that they can wear, that's absolutely fine, you know, if they can wear it. I think the most important thing is like they can wear it safely not in the sense that it will suffocate them. I think if there's a 1.5-year-old that can wear it, that's completely fine. It will not suffocate them. It will not reduce their oxygen levels. But I think, you know, like you correctly said, the most important thing is that it must fit nicely, must fit snugly, you know. And so even if there is like 2 sizes, right, there's the adult size and there's the children's size. Even the children's size can be a bit too big for some of the very young kids, you know, and then it doesn't fit very nicely. You've got gaps here, you've got gaps here, and I think when you say safely, it's that, you know, they don't keep touching the mask, so they're not going to be very conscious about it, so they're like doing this and then they'll be rubbing their eyes, and so that will defeat the purpose. However, there are ways actually to fit the mask more snugly, you know, for adults as well as for children. And so if you look at the latest recommendations by CDC, there's a way where you can actually knot the mask close to, not the loops, close to the mask, like so. Yeah, so this is something that we can use for adults, right? Yeah, can you see that? Yeah, so we want to knot it really close to the mask, not over here. I've seen quite a number of people where you knot it over here, and sometimes when you do it quick, you also don't do a very good job, because when you wear it, you want to, you know, sort of like pleat this in, and it must very nicely, it fills up so you don't get a gap over here. Yes. But, you know, and the beautiful part about it is I realized that you can, if you run out of the pediatric or the kid size mask, you can also sort of like tweak your adult mask to fit, for example, like a 2-3-year-old. It fits my son. He doesn't quite like it, but that's another thing altogether. But you can still do it, right? And I'm going to show it on the other side over here, whereby if this is the part where it's the wired, you can fold it into like this, like so, okay? And then you fold it down towards here, and then you knot it. Then you knot it like how I showed you we knot it. Oh, sorry, this is a bit difficult to do. Okay, I'm going to do this.
We're not
triangle it.
Yet, so
bring it down.
Don't know how to do this.
I'm gonna do a reels after this in my in my what, so you can see. And then after that, you knot it to the side over here. And when you and you can see, it sort of like gives a little cup. And imagine it on the other side.
Smaller.
Yeah, a smaller face, you know. And I like this type because then it gives a gap as well for better talking, you know, for better breathing. I feel, you know, even on myself, I like the loop better, the loop method better than the double masking. So on to double masking, I think it's good, and I think that I really like what one of the doctors says, you know, that multiple layers help, but the fit is critical. So it has got to fit you. And personally, I've tried this in clinic because I've developed a very bad allergic response to N95 mask, Rakhee. Horrible, 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 horrible. I had to put on a lot of medicated creams. So I was really glad when we found that there was this alternative ways. And so I found, I wore double mask. And I must say that wearing an N95 mask for me, actually I could breathe better. But it's a very good alternative. And so because the reason is when you have something rigid like this over, if all of you wear, you probably with a smaller face like mine, you probably know that you've got gaps here, you've still got gaps here, and my spectacles will fog up. But when you automatically put a cloth mask over, then the cloth will actually pull the mask towards you, and it's a much better fit. So if it's breathable for you, it's comfortable enough for you, then that is a very good way. For children, I think it can work for older children. I've seen some of our patients, the older patients, coming in with that, and they seem fine about it. But it may not be so well tolerated by the younger kids, you know, the younger toddlers. So I think most
in the primary school going children, would you say that primary school going children will be able to get a double masking thing going, but below that, just get a good, nicely fit, snug mask that would do the trick.
Exactly, but you need to have some feedback from your child. So that's one of the things that I felt when I double masked for a long period of time, like 6 hours in clinic, right, was that my ears started to hurt, and I had a headache from that. So I think, you know, so I think we have to tell our kids, you know, if at some point when you feel a little bit uncomfortable, it's okay to remove one mask safely, teach them how to put them into a plastic bag, and to have several changes of masks for them, so that they can, you know, rest a little bit when they're a bit isolated from other people, rest the ears a little bit, especially those with eczema, you know, with constant abrasion, you know, something over your skin, you might get a flare, and then, you know, change up.
Yeah. So interesting that you brought up the allergy. I think we're seeing a lot of acne, pimples, rashes, eczema flares, what we call the mask rash over the face. So you've got the whole line around here as well as around the chin. So we're seeing a lot more kids who come in that way as well. So it's important maybe to put in a bit of emollients or moisturizers for those who've got sensitive skin, so that you don't have these rashes too much, and maybe a little bit over the ear if you've got an eczema rash over there as well. So this is very important. But there's also another aspect that I think is important for us to note, that whether you wear a mask or not, you still have to continue to wash your hands, physical distance yourself from others, and get the vaccination. So I think you shouldn't feel that I'm wearing a mask, I don't need to wash my hands. I'm wearing a mask, I can still hug you and do all sorts of things, you know. So I think we should not think that it's taking over the place of any of these other things. We go along with all the other respective ways that we can. Good ventilation is something that we also need. So we have to make sure that we have all the other things as well. And you mentioned earlier, let me bring you back a little bit earlier to when children should wear a mask, or even when adults should wear a mask, is if they go out in public areas. Also traveling. So if you're taking a public transportation, buses, planes, I know we're not traveling much, but there are some who are. So planes, traveling by buses, trains, even taxis, you still have to wear a mask. If I'm not mistaken, Grab drivers don't allow you to enter the car if you don't have a mask on. So make sure you always keep a spare mask with you in your bags and everything else. The other part for children is you have to wear a mask when you go to school. In fact, my daughter's school issued a letter that said they have to double mask. So that's why I said double masking in kids. I guess at some point we'll have to deal with it. So they have to double mask, but keep extra mask with you, and always give them a mask bag so they know when to discard one. And the moment a mask is dirty, or you find that it's wet or it's torn, you have to discard it and get a new mask. So what about, should children stop wearing a mask when parents get vaccinated? You know, all of us are so eager to get our vaccines that we realize, once the CDC came up with this guideline that said that if you're vaccinated, you don't have to wear a mask, and you don't need to physical distance. So I think that's a little bit premature. I
don't quite agree with that one, really.
Neither do I. So what are your thoughts?
So I mean, if your common sense would tell you, like, parents getting vaccinated has nothing. It has nothing to do with our kids, right? So it's vaccination is protection for us. Even that is not 100%, right, Rakhee? And so even if ourselves, the adults, have vaccinated, we should still adhere with the SOPs of masking, of social distancing, of proper hand washing. What more our kids? And even if it comes to the point where we are able to vaccinate our kids, I really think, like you say, it's too premature to stop all these steps. And so our children should still wear the mask. We should still be doing, be adhering to the strict SOPs. Yeah. And right now, what is the percentage of our vaccination in our country? It's not hurt.
Yeah, we're only at about 3%. We're nowhere near the 75% or 78% that we're supposed to get.
Exactly.
So we're nowhere near that. There is no herd immunity in our country. So definitely need to wear a mask. Just a side note there, that if you have a newborn baby, if you have an infant that's below 12 months old, it's very difficult to put a mask on them. And the best thing to do would be to mask up the people that are around the baby or the infant, so that it reduces the chances of whatever you have to your newborn baby or to that child itself. I think, so, and getting vaccinated does help you to protect your children, your family little bubble. So parents should get themselves vaccinated. And at some point when children are able to get vaccinated, I think we should be able to get the child vaccinated. So more and more people create a better herd immunity in that sense. But we should not take for granted that wearing a mask is going to alleviate any of these, and we're going to not, because whatever CDC says may work in America because of their 50% that's already got vaccines, but we are at 3%, guys. I mean, that's, so we're nowhere near. So just keep the mask on. Keep the mask on in the right way. Please cover your nose as well. I see so many people who still have it here, so it's above here. The mask should be here. So wear the mask the right way.
And if I can say one more thing, we still have a few children with face shields as well. I think there's no problem wearing face shields, but it should never be a substitute for mask. So, it can't be just a face shield and not wearing a mask. That doesn't work, I've seen also some parents bringing in newborns with the face shield. It's really cute. But
I guess it's a placebo effect. They're doing something to protect their child. There's nothing else. They can't put a mask. Like I had a 11-month-old child that came to clinic today with a mask on, but it's just on the face, so it's not around the ears or anything. So I'm like, it's just, I guess, so that parents feel they're doing something. But we should always remember, wearing a shield alone does not protect the child.
It
so must have everybody around. Absolutely.
I also understand the challenges in getting a very young child to wear a mask. So sometimes, if I think when I see a child, very young child, like 2-year-old, right, 1.5 years old, having just a mask dangling over there, I extend a little bit more grace, because I think one of the ways that we can help get a child to get used to it is just to let it dangle there first before putting it properly. I think one of the things is we want to make it enjoyable, or rather not a negative experience for a child, especially when you first want to introduce the mask. So if I can just say, because it's something foreign to them, so if I can say that if there are some tips that I can give, to parents who want to introduce wearing a mask to a very young child, because I've got 2 very young children with me as well, right? Is number one, we can try going in front of a mirror, because that's time where developmentally they like to look at each other, they like to look at their body parts in the mirror. So we can introduce them to the mask while looking at them in the mirror, and we wear it ourselves, and we can in age appropriate language, age appropriate terms, to tell them why it's important to wear a mask. We can also, another thing that we can do is to get their favorite soft toy, and then wear the mask on their soft toy and sort of role play it, And other than role play, I think role modeling is even more important, and that we ourselves as adults should be shown to be wearing the mask in the correct way, and that will help them. If they're going to school, I think peer pressure, positive peer pressure is the best. When they see other children wear the mask, and that would help them to wear the mask as well. So I think this is, and you know, don't scold them. I think when they don't want to wear, the young children don't scold them. You know, you tell them, no, there's an awful virus out there. You're gonna die if you don't. I mean, that's not gonna happen.
It's not gonna happen. Yeah.
So let's try to, you know, extend some grace and help them just to get used, even at home, even though we're not supposed to wear it up, rather not supposed or don't have to wear it, we can practice wearing the mask for short periods of time at home just to help them to get used to it. And so I think then they will take to it better when they actually really have to wear the mask outside the house.
Just an extra point to that is what worked for my kids was there are so many masks that you can get online. So my girls got the princess mask and the boys got their dinosaurs and cars mask. So, you know, get the cartoon characters that they like. You've got even the Avengers mask. So, you know, you can get whatever cartoon or whatever, maybe softer. I see Spider-Man. So get their favorite cartoon character mask. Let them choose the design. And let them, I have a few boxes actually, so I give them the autonomy to choose and, you know, to decide, okay, today I'm going to wear the dinosaur mask. Tomorrow I'm going to wear the Peppa Pig mask. Tomorrow I'm going to wear the Minion mask, you know, so I let them choose that. And for home practices, I actually get the cloth mask, so I don't waste the surgical mask. So I like to play around with the cloth one, and then I throw it in the washing machine and I wash them. So yeah, don't forget to wash your cloth mask after every use. Sorry, just to since I just thought of that. Yeah, just to put it out there, don't forget to wash your cloth mask. And there's this new picture I see everywhere for adults. When you double mask, they say don't wear 2 surgical masks, don't wear 2 cloth masks, always wear 1 of each. I think it doesn't matter really what you're wearing, as long as you're wearing a 3-ply surgical mask together with a cloth mask. It's because of the better fit, like what you mentioned.
Exactly.
If you do wear 2 surgical masks, I mean, you're just wasting an extra surgical mask when you can actually use that for the next day. So we're practicing some sort of eco-friendly way as well. So that's why the 1 surgical mask, 1 cloth mask is also very important. And choose your designs. There's so many local entrepreneurs out there. We're all trying to survive. So go to the local guys and get one of their masks. You can find so many of them on Instagram. Help them out. And get, you know, a batik design or sequined ones or something homemade. You know, at least we're helping another entrepreneur out there as well. Yeah,
if you can't spend money on cosmetics, then spend it on
masks. You might as well get fancy masks, you know, since you can't wear makeup anymore. So yeah. All right, thank you so much, Dr. Rakee. I think we've discussed everything that I think we wanted to talk about with regards to masks. If there are any questions out there to everyone, please let me know if you have any queries or concerns, or you want to clarify anything that we may have discussed or we may have missed out in today's session. Do DM me or Dr. Rakee. Do check out her profile, Dr. Rakee's Crib, for anything parenting related and tips on how to handle children and follow her journey with her 2 kids. Thank you so much, Dr. Rakee. On that note, tomorrow is my next session, and I will be having Megan Tan. She's an influencer, and we'll be discussing about how her journey was with getting the AstraZeneca vaccine.
Nice.
All right, take care, everyone. Bye.
Bye.